We start tonight with a look at how our hospitals are coping. Now, these restrictions are and always have been about saving lives, of course, and easing pressure on our NHS. We're in Bridgend's A&E department tonight, the town with the highest COVID rate in the UK. Staff at the Princess of Wales Hospital told our health correspondent James Crichton-Smith today they're being pushed to the limit.
This is the emergency department of the Princess of Wales Hospital in Bridgend, and it's working at full stretch. Watching it from one of the beds here is Jennifer.
You're running around, you don't stop. You know, from one to another, but they get your care that you need. I mean, I've been isolated with my husband since it all started, since last year, and my husband has as well. And I can't understand people why they won't listen to what's going on, because it is real.
Jennifer was worried about coming in and adding more pressure, but staff are urging people in desperate need to still seek help. Pre-COVID conditions haven't gone away.
Be under no illusion, it may look quite calm in here, but each of these bays is full of patients. And this is just the non-COVID emergency department. Just through there are 23 more trolleys, all with COVID patients.
But this isn't just an A&E challenge. 70% of patients in this hospital are COVID related. Many of them are on wards.
On our ward, you know, I've got people my age, I've got people 40s, 50s, 60s. You know, there's no reason why some of these people are so sick. And I just think the message is you don't know how it's going to affect you if you get it.
We've got a job to do and everybody is committed to do that and they're willing to come in every day. It can be scary as well. We've come to get used to that, but it is scary and we see different things every day. And yeah, we've got to deal with that.
But at the front door, more very ill patients continue to arrive. The second wave is flooding departments like this across Wales.
Since we've been filming, the ambulance service has phoned ahead to say it's bringing in 2 very ill COVID patients. You've just seen one of them be taken in. Now that patient will get a bed. The patient that's arriving just now is also severely ill with COVID and needs a resus bed. But right now, inside this hospital, there is simply no resus bed to give them.
It means care falls short of the standards staff want, but becomes a matter of what's possible. Risks are being taken and people are being asked to do things they never expected to do.
It takes 5 years to train a critical care nurse. We can't just pull people from other departments to be able to care for these people to the standard that we would expect. They are being trained very quickly to be safe and to provide the care that we can, but we can't just pull staff from anywhere.
So, I mean, what it means then is you do have staff who are not specialists in critical care, but are having to do jobs far and above what they might normally do.
Yes, and it's scary. They are terrified. We are pushing our staff to the limit. Even my most experienced team are finding it challenging, physically and psychologically.
How are you finding it?
Very difficult. I lose sleep because I worry about my staff and the patients.
There will likely be more sleepless nights to come. Today there were 56 more COVID deaths reported and nearly 2,500 new cases in Wales. But there was too another vaccine approved, a chance perhaps to dream a little about life after COVID. James Crichton-Smith, ITV News, Bridgend.